Welcome to the Prevent the Preventable podcast, where we're on a mission to change the landscape of brain hemorrhages by driving awareness, delivering education, and pushing for real action. Now, brain hemorrhages affect millions of lives every single year. But at the Nathy Kate Moss Trust, we're committed to preventing them before they happen and funding pioneering research to advance treatment for when they do. In this podcast, we'll dive deeper into the world of brain hemorrhages because the more we understand, the more we can create real change, and together we can truly prevent the preventable. Hello and welcome to today's episode of the Prevent the Preventable podcast. I'm your host, Fiona, and thank you so much for joining us for what I believe will be a hugely important conversation to kick off this new year. Now, January is always that moment where many of us hit reset, setting new intentions, focusing on health and thinking about the small changes we can make to improve our lives. And whilst diet, exercise, and potentially stress management are usually at the top of this list, there's one factor that doesn't often make it into the conversation, and that is our favourite topic, blood pressure. Now, I think one of the most interesting things about blood pressure is that you don't really feel it day to day, but it does play a huge role in keeping our brains and bodies healthy. But when it's quietly higher than it should be, it can quietly put strain on blood vessels over time. Hence why it gets the nickname, the silent killer. And I know that that can sound quite scary, but there is some good news. And that is that it is something that we can monitor. And most importantly, blood pressure is something that we can manage. What's becoming even more important is that this isn't just an adult issue anymore, or an old person's problem, which is a common misconception. With changes in lifestyle and particularly an increase in childhood obesity, paediatricians are beginning to see more and more cases of high blood pressure in children too. And that might sound surprising, but it also means that we have a real opportunity to get ahead of the problem by having open conversations, encouraging healthy habits early, and making sure checks are part of the normal health routines. In today's episode, we'll be joined by Dean Wallace, consultant paediatrician, who will help us unpack what blood pressure actually is and why it matters so much to brain health. We'll talk about why children aren't immune to this and why so many cases in young people go undiagnosed. We'll discuss how childhood hypertension is becoming a growing concern and what that means for the future. And most importantly, we'll talk about the simple checks, lifestyle shifts, and conversations we can have with our children that could prevent problems later in life. So, as we step into this new year with health front of mind, I hope today's conversation inspires you to take blood pressure seriously for yourself, your loved ones, and even the next generation. Let's dive in. Dean, hello. Welcome to the Prevent the Preventable podcast. Thank you very much for being with us.
Pleasure. Thank you.
We speak a lot as a charity, but also on this podcast about blood pressure, because we know that high blood pressure is a leading cause of lifestyle-related brain hemorrhages. But it's also one of the most modifiable things that we can kind of approach in order to prevent brain hemorrhages. You know, there's lots of other things that might cause a brain hemorrhage, but this is something that we can actually take control of, whether through lifestyle predominantly or through medication as well. And I think one of the biggest challenges that we see with blood pressure is that people aren't just checking it in the first place. They're not aware, they're not educated enough to understand blood pressure, the risks of blood pressure, and be checking it and know what the numbers mean, you know, et cetera, et cetera. So what we are trying to do as a charity is to expand that education. And I think something that's become more and more apparent to me and to us as a charity is that there is this common myth that high blood pressure is a quote unquote old person's problem. And yes, sure, it's definitely more prevalent, but it's not just exclusively a problem for old people. And it's a problem for adults of all ages, but it's also a problem in children. And that's something that I don't think gets talked about enough. And that's what we're going to explore today. And we'll come on to that. Before we do, could you just give us a brief overview of who you are and your work and what you specialise in?
Yeah, so my name's Dean Wallace. I am a consultant paediatric nephrologist, which means I'm a kid's kidney doctor. And I work at the Royal Manchester Children's Hospital just down the road from here. I've been a consultant for about a decade in Manchester and in London before that. And I predominantly work on dialysis and end-stage kidney disease. So hypertension or high blood pressure is a really prevalent thing in my work. I'm a clinical trialist, so I investigate new treatments and drugs for all types of kidney conditions as well. And I, along with my team of colleagues, are responsible for looking after the blood pressure of the children in the northwest of England.
So there is obviously implications of having high blood pressure, short term and long term. And that's obviously an issue in adults. Now, what are the implications of a child having high blood pressure? Whatever that age is it the same if it's a baby versus, a teenager? But what I really want to explore is what happens to a child's body when they have high blood pressure at a young age.
Well, essentially, the principles are the same, unfortunately. The only major difference being is that if you get a foot in the door early with recognizing high blood pressure and instituting potentially initially lifestyle changes to address that and subsequently medicines to make that safe, we actually expect to be able to remodel and to essentially heal the system, really, and actually reduce those long-term risks for children. But if it goes unrecognized, unmodified, untreated, then you're going to have the same long-term effects and outcomes as an adult. But it may take longer to manifest because of the starting health of the system, the compliance of the blood vessels, the plasticity of the whole system. So, long-term hypertension in children would cause problems with the heart itself. You would get eventual thickening of the heart muscle, which we call hypertrophy. So we look at the left ventricle on these heart scans. You'd see thickening and stiffening of the blood vessels, which carry the blood and transmit the blood pressure. And more importantly, you see changes in the end organs. So you see actual measurable, demonstrable changes in the kidneys, the liver, the heart, the eyes, and ultimately the brain as well. So whilst there are caveats about how long it takes, we can think of the two as the same, really. The same outcomes will happen for children with long-term blood pressure as do for adults.
Can those changes be reversed? So if a child has hypertension and then you sort it out, does that then impact their health in the long term? Like, has there been, a sort of a mark on their health, or can they go back to being fully healthy?
If they haven't sustained any end organ changes, which can be permanent if it's been there and sustained for a long time, intervening on blood pressure will actually reverse the system. It will reverse the changes, really. And children are really good at that. They can remodel the system. So, for example, it's really pleasing to me when I look at somebody's heart who's got high blood pressure as a child, and I see this thickening of the heart muscle, and we do a specific measure of that, and it gives me a number, and I can tell if that's where it is in the population in terms of the size. And then after treatment on 6 months, I can see these changes disappear and reverse, and it's a really satisfying thing to see. So yes, all things being considered, I'd expect mostly to reverse those changes.
Which is great news in itself, because I think one of the biggest worries with hypertension is that people think, oh, they're damaging the body, and there's this long-term implication, which could be true to your point there, but actually it can be reversed as well. Let's just talk about, set the scene of is the scale of this issue, because I think we touched on it before. You don't expect children to have hypertension, but obviously they do. Is this a few cases that we're seeing, or is this thousands of children? Are you seeing children regularly with hypertension?
Yeah, I mean, so to put into context, I was at a meeting yesterday. I was talking to an adult kidney doctor, and we're talking about high blood pressure. And he was asking me a similar question. And when I told him something about it, he was stunned as well. So to talk to the general population about this, it's quite shocking. But yes, it's a big problem, and it's a rising problem. And again, to put it to a bit of context for you, up until about the 1970s, we didn't really know anything about children's blood pressure or what it was supposed to be. It was considered to be a stable thing across the ages, and most children were compared against adult blood pressures. And the difference being is we know with certain adult blood pressures that a certain cutoff level corresponds to certain outcomes and changes later on. So that's where the cutoff levels are in adults, and they were used for children. So the children who got through and were measured to have blood pressure as high as an adult high blood pressure were the most severe cases.
On that, you mean the number that we would get from the machine?
Yeah, from the machine, from the adults, essentially. So that used to be around 140 over 90, as you probably heard on previous podcasts with previous adult doctors. And so children were used to be compared against this standard. And so only the most severely hypertensive children were diagnosed. And usually those children had an underlying medical cause driving that high blood pressure. So it wasn't a primary type of blood pressure that was you probably hear about in adults all the time. It was this one. So it led to one of the myths actually that children have an underlying cause for high blood pressure that is identifiable and treatable with a magic bullet, either a narrowing in the artery to their kidneys or a hormonal problem with excessive steroids in their body and things like that. And actually, what we know now over the population studies over the last several decades is that most children have got primary hypertension just like adults. And that's a mixture of genetic factors, predispositions, environmental exposures, and lifestyle factors, particularly obesity.
Yeah.
And that's 10 times more common than the secondary causes, even in children. So we do an awful lot of investigations in children with high blood pressure looking for these unusual causes. And it's still quite rare that we find those underlying causes. Most children have the same type of high blood pressure that adults have.
Sorry to interrupt, but this one is actually quite important. We often get asked, what's one thing that you can do to help reduce your risk of a brain hemorrhage? Well, the answer is actually pretty straightforward. Check your blood pressure. And here's why. High blood pressure is one of the leading causes of brain hemorrhage. High blood pressure can affect anyone, and a third of the population has high blood pressure, and 50% of those people don't even know. But the good news is that high blood pressure can be managed, but we need to know our numbers first. So don't leave it to chance. We've made it super simple for you to remember. Sign up to our free monthly reminder service and we'll nudge you to check your blood pressure every month. Quick, easy, and no excuses. Tap the link in our show notes to sign up for your free reminders now, because if you can prevent it, why wouldn't you? That's really interesting. So from what you're saying, essentially, the numbers have shot up because of the way you measure it now, but also presumably them from environmental lifestyle factors, which are having a massive impact on those lower level sort of, cases of hypertension. Would you say that?
Yeah, those kind of slightly more subtle and lower end high blood pressure cases that are still abnormal, but aren't, very, very high compared to the adult standards. And what we use in pediatrics, we did these big studies of thousands and thousands of children, measured their blood pressures, and based on their age, sex, and height, we produced these tables called centile charts. And so children are defined as having high blood pressure if they have blood pressure greater than the 95th centile, which kind of accounts for about 5% of that population. So anywhere from 3 to 5% of children in populations we think are hypertensive in childhood, and that's compared to around 15 to 20% of adult population. So it's less of a problem in the population of children than in adults, but it's still a big thing. 1 in 20 children is probably hypertensive.
And what's causing this?
Well,
when we talk about lifestyle particularly.
Yeah. So when we talk about primary hypertension and the factors that go into it, so there are genetic factors that we don't know about. So it's not, there are some single gene problems that we can identify as really rare causes of high blood pressure, and they're really interesting. And whenever we find those, we're always really not excited, but, really interested by those. But there seems to be an interplay of several genes that are unidentified because we know it runs in families as well. We know there are familial tendencies towards high blood pressure. But that can be blurred by familial tendencies towards certain ways of living. And we've got increased sedentary lifestyles, we've got increased processed food intake, which contains a lot of salt and sodium particularly. So our dietary sodium in the West has gone up massively over the decades, and that is a huge thing there as well. Certain exposures, even when in the womb it starts, in utero as well, there are certain environmental exposures to toxins, phthalates, microplastics that have been associated with hypertension. But the main one is obesity and carrying excess weight. And it's no over-reporting to say that we have an obesity epidemic, and it's rising and getting worse. And we are now seeing more and more children referred to hypertension clinics who have, very elevated body mass indexes. And that's the primary cause of the hypertension that we are seeing at the moment in pediatrics.
Do we know what those numbers are in terms of the rise of obesity? Is that
Well, I couldn't tell you off the top of my head, but year on year, the incidence of people who were classified as obese in childhood is going up in the UK and across Europe and the world.
Yeah, which obviously is a huge. It's probably not just hypertension, then, is it? It's probably causing a number of other conditions too. It's a massive problem, really, in our society.
Absolutely. Hypertension is only one wing of it. We're going to see a surge of type 2 diabetes in the next couple of decades as well, unless certain things happen at a population level and public health level. But it is the most concerning thing. There have been a couple of government initiatives. For example, just my wife was part of a government program that was looking at obesity in children exiting primary school, and so all children exiting primary school were heighted and weighted and had their body mass index measured, and they were offered a year's worth of interventions to reduce their weight and work with a dietitian and a weight worker. Now, interestingly, not a single one of those children, as part of this assessment, had their blood pressure measured. And I suspect, had that been happened, you'd find quite a high incidence of blood pressure in those children as well.
Yeah.
So there's a population out there as well that we don't know about, that are walking around hypertensive.
So I suppose that's the biggest challenge, right? Because I think there's probably, I know from a Office of National Statistics report that the age group 16 to 35 have the highest percentage of undiagnosed cases of hypertension proportionally to the number of cases, presumably because they are not going to the GP for as many things as somebody who might be plus 50, plus 60, plus 70. So they're not, within that clinical medical environment where, they might be checked for blood pressure.
Mm-hmm.
And I'm sure that it's probably even rarer that a child who is 8, 9, 10 or younger, or just a bit older would be in that environment where they would be checked. And I think that's one of the biggest challenges, or I imagine that's one of the biggest challenges for you, is that, like you say, they might be hypertensive and running around a little bit overweight, but their parents kind of just like brush it off like, oh, they'll grow out of it, or, those sort of expressions, but it's actually causing them a major problem. Plus, I would imagine there's another layer to that where GPs would probably not assume that a child would be hypertensive. So why would they even think to check their blood pressure? So what is it that needs to be done at that level then? Is it more cases of awareness, education? Is it more cases of actually training GPs to check properly? Because I imagine, to your point before, it's difficult to check children versus adults. There's different measures.
Yeah.
Right in saying that height and weight play a part in the readings as well. So it's quite complicated too. So do we have the right system, or is that something that needs to be addressed on a national level?
Yeah, that's a huge question. So,
sorry to put you on the spot there. It's like Prime Minister's questions.
That's the question. It's like, how do you fix it? But so starting off with awareness, I think the general population, any healthcare professional needs to be aware that children do suffer with high blood pressure. And opportunistic encounters with GPs and healthcare professionals, when children are having their observations done, they'll typically have their heart rate measured, maybe their oxygen levels, their height and weight, and but rarely, if ever, a blood pressure will be performed. That is based on those probably old assumptions that children largely don't have problems with blood pressure, so don't bother measuring it. You're going to get yourself into all types of knots when you get a number you don't want to when you see it. And that's probably a little bit of its head in the sand kind of thing there as well. So the awareness that children do have high blood pressure is important, and an awareness of measurement. The major problem with getting to a diagnosis, an accurate diagnosis, is a problem of the reproducibility of measurement. So you're probably familiar with the type of blood pressure monitor you go to your GP with. It's a little machine. They put it on, they press it, and it automatically inflates and goes up and goes down. Okay, and that's a kind of technology which is called an oscillometric thing, and essentially it measures your average arterial pressure, then based on a mathematical calculation gives you your top and your bottom number. It's not actually your top and your bottom number, but it's what the machine kind of estimates. So they're not very accurate as individual numbers, but they're good screening tools and good monitoring tools. Now, those machines are not designed, built, or validated for children. So, and in our realm, they tend to overread, so they tend to overcall hypertension in children as well. So children largely require a good manual blood pressure, the good old-fashioned way of doing it on most children, which requires a bit of a basic clinical skill, which is being lost from medical schools and nursing schools. It's done very poorly in primary care with the old type. You have the stethoscope and the manual one that you pump up, and you get the accurate top and bottom number. And we have a problem for very, very small children where your stethoscopes just can't get small enough to put it and find the artery. We use a system called a Doppler measurement. So you've probably, it's just like the Doppler you see if you went to an antenatal appointment and it's put on the abdomen. You can hear the heartbeat of baby. So it's a little device that you put on the artery, and it measures the flow and sound, and you hear it as a kind of whooshing sound. And we use those in small children because we can find the artery over that, but it only gives us the top number. So you can imagine, so we've got 3 different ways of measuring it. There are about 10 different cuff sizes that has to be appropriately matched to the arm and the size of the child as well. So you can imagine GPs and primary care institutions are going to have to get a lot of new equipment. There's going to have to be some basic training going into it. And that's a big ask of general practice. They've got enough to do.
Yeah.
You know, they do an incredible job. And this is not a criticism of general practitioner colleagues. And even if they've got that, then you need to know what to do with the number.
Yeah.
And unlike adults where it's quite clear, this is high blood pressure, this is not, and this is very high blood pressure. In children, you've got these quite confusing big tables of numbers that you have to interpret. But we have produced a very simplified table of that gives you the rough cutoffs in children. So they should certainly be in GP practices and with nurses and school nurses and other things like that. And I think it's going to be, instituting a national screening program is probably not going to work in a sense, but I think there are key opportunities. For example, that leaving primary school age as well before going into high school. Other countries do national screening programs for various things like checking the urine for blood and protein as well. So I think that might be a good opportunity to add a blood pressure into that, particularly for the children who are identified as having clinical obesity as well at that time. And really, any time you go to see a healthcare professional, it's an opportunity to have that blood pressure measured and looked at and considered randomly or in the context of whatever you're going to the GP or nurse with. So it's awareness, correct measurement and equipment, opportunism, and knowing what to do with the numbers.
Huge thank you to Colony Co-working for continuing to support the Prevent the Preventable podcast. Now, at the Nathalie Kate Moss Trust, we have a huge ambitions to completely change the landscape of brain hemorrhages. And whilst we're a small but mighty team, we're all working remotely. And in truth, that's part of our strength. Remote working means that we can connect with incredible talent from across the UK and around the world, helping us push forward faster and smarter. But without a central office, we need flexible, inspiring spaces where we can come together to work productively, collaborate meaningfully, and work on this huge goal we have set ourselves. That's where Colony comes in. Colony is a growing network of beautifully designed co-working spaces here in Manchester, home to creatives, founders, freelancers, and teams of all sizes. They are spaces built for focus, connection, and progress. Not just a place to work, but an environment that actively supports your growth. And they've helped NKMT do just that. To find out more about how Colony could support your business, check the link in the show notes. Yeah, I do really think it comes down to, it does start with education, doesn't it? And awareness, as you point out there. And it feels to me, as you said, if there are certain tests that you're already doing, such as height, weight, etc., if it's demonstrating a child's obese, it should be like next port of call. We then check their blood pressure, because that is obviously a major factor towards them having hypertension. I suppose this is all us just conversing about it now, because it's not actually changes that are being made, but I think it does start with also parents being aware. If you are thinking your child might be carrying too much weight and thinking about, well, what's their lifestyle like? Do we need to make any changes? Should I get their blood pressure checked? And kind of, I think the whole point of these sort of conversations is giving the listeners a bit more, putting the onus back on them a little bit, because as you say, general practitioners do have a lot going on. So we can't, whilst we do want to rely on them and, they're great. But I think it's also good for us to be empowered in ourselves to make sure that we're kind of checking things at the same time. If we're looking at that from like a parent's point of view, are there any signs that they can look for to suggest, or maybe we do just need to get their blood pressure checked for their children?
Yeah, I mean, unfortunately, a lot of high blood pressure in children would be completely asymptomatic and silent for a very long time. So on the whole, the patients who get referred to us are largely asymptomatic, and it's been an opportunistic finding whilst doing something else and someone's thought to do it. But if it's been there a while, you can have symptoms. The commonest symptoms we get are headaches, largely due to the increased blood pressure causing increased pressure in the cerebral circulation, and that can cause pressure-type headaches and migraines. We sometimes see children complain of visual disturbance and visual blurring. We sometimes see fainting, syncope episodes as well. And all the way towards the more severe end of the scale, you start to have neurological features. There can be subtle personality change that the parents pick up on, confusion, delirium, ultimately seizure. And when it's very severe and very acute and very high, thankfully that's quite rare and needs managing completely differently from long-term high blood pressure. And you can have a variety of cardiovascular symptoms as well. So some might complain, it's odd in children, but I have had people complain of chest pain, shortness of breath, and reduced exercise tolerance as a result of high blood pressure. But that's not as common as it would be, for example, in an adult. But I would say, headaches, certainly chronic headache history, which is a very common thing to go to the GP for in childhood and teenagers. And again, rarely a blood pressure checked.
Yeah. What is that? When we say childhood and then you said teenagers,
Mm.
what are those age brackets? Like, are we talking child will be up to 12 and like formally then a teenager is 13 plus?
Yeah.
That's okay.
Yeah, around that time.
And when would someone medically be deemed an adult?
So medically versus legally. It's that's a really good question. It's a really philosophical question, actually. But we see children, physiologically, once you're over the age of kind of 16, you're definitely an adult. You're still growing up to your early 20s and developing, but the physiology doesn't change much in terms of it's much more adult-like physiology. So we see children and young people all the way up to 18 if we need to in the children's hospital. We tend to transition their care between 16 and 18 to adult services if they need it. So that's what that age group really means. Infants would be, very small children up to the age of a year, and then small child, adolescent, teen, adult.
But when we're talking about like these charts and thinking about what different ages, we're talking more about like using those charts that you'd use for children up to about 16.
Yeah, actually, and the different agencies around the world use slightly different cutoffs, but largely, if you're over 14, we tend to use the adult criteria for blood pressure values when we look at the studies, but these tables go all the way down to zero in terms of age as well.
So obviously we touched on children, the rise in childhood hypertension is growing a lot in line with the rise of childhood obesity. Also in line with the fact that we are measuring it differently, sure. But lifestyle is such a major contributing factor to this issue, this growing issue. What are some everyday changes that parents, community, schools can make that are very realistic to help reduce this issue?
So children and young people have to move more. Okay, so it's as simple as that. So the sedentary nature of in the Western lifestyle over the last several decades has certainly contributed to that. Particularly children spend a lot more time on screens, on video games and socializing online. The pandemic made that so much worse. It was already an issue, but that really accelerated and put a fire under everything. So a lot of children were suffering with severe anxiety and have never really recovered from that kind of that once in a generational stressor. And schools with their PE programs and their activity programs, and parents as well, should increase physical activity, and it's best to do it across the family. I try not to single out the child or index person for extra activity, and I talk to them as families and say, what can we do as a family? Can we be going out for long 1 to 2 hour walks 3 times a week? Can we walk to school rather than taking the bus, and various other simple things like that? So movement more, but we like to say to people, you need to be doing some kind of physical activity that gets you red and breathless in the face for about an hour, 3 to 4 times a week at least. And even if you don't start to address dietary changes, that in and of itself can make huge difference to their cardiovascular fitness, if not weight loss as well at the same time. And we try to avoid stigmatizing children by talking in terms of weight loss itself, but we try and talk more in terms of making the right choices and these positive lifestyle changes, and weight loss becomes a byproduct of that there as well. So increased activity, increased movement, doing it as a family in a group, and reducing snacking and sodium and salt intake. And that's the really hard thing to do, because here we have, a very, very big risk factor. It's very, very hard to monitor and measure your salt intake. It is there on packages of food, but the way it's reported is quite difficult. Some people report it as salt, some people report it as sodium. So you need to know how the two things interact, the numbers with each other. But we are, as a population, taking in 2, 3, 4 times the recommended daily intake of salt.
Thank you to our sponsors, Hugh James Solicitors, for supporting this second series of the Prevent the Preventable podcast. Now, sudden brain hemorrhage can turn your world upside down, but discovering it was caused by a medical mistake makes it even more devastating. While nothing can change what's happened, Hugh James's medical negligence team is here to support those who suffered brain injury or bereavement due to medical errors. And their support doesn't end there. The Hugh James Wills and Estate team is also on hand to help you plan for the future with clarity and care, because when the worst happens, the last thing you need is added complexity. To find out more about how they can support you and your loved ones, head to the services page on our website and book a free call with them to discuss your concerns. You can find the link to all of that in our show notes. Yeah, I think what's really hard with this, and I imagine you pointed out there, you don't want to kind of directly speak to the child about weight or directly point your finger at them and go, you need to change this, but it's a family thing, is that all these changes are actually going against what is now becoming a bit of a social norm. And I imagine the risk is that you then get this child sort of like frantically thinking about like what they're eating, that they need to be doing all this exercise. And especially when they're young and they're very influential, that could lead on to other problems, like being anorexic or being, really hyper focused on their weight. And suppose it's just this constant balance all the time, isn't it? And I think that's where if we can shift things culturally, which is so much easier said than done, it would become more of a norm to eat healthier, move more. And so it wouldn't be this pressure on this child, which I'm sure, as I say, must see quite a lot.
Exactly. And it really comes from the parents taking the lead on this there as well, because if they're, most children up to a certain age eat what they're given.
Yeah.
Rather, I mean, it's easier for children to seek out additional foods, processed foods, snack foods and stuff with their friends, and they are cheaper than ever. And unfortunately, a lot of takeaway foods are targeted at young families for convenience, expedience, and they're quite cheap compared to some healthy foods. So there's that as well. The NHS has an excellent website called NHS Fit for Life, which we often refer a lot of patients to. It's just got really good ideas about the kind of things to eat and the kind of things to do as a family in terms of activity. We used to have great local programs. I think the name of it used to be called the MEND program. We could refer children to it, and it was like a 6-week course where they would learn cooking skills, they would exercise and do all things like that. It was a weight loss program, but it was done with other children. It was not very stigmatizing, but I think with government funding cuts, I don't think that program is available anymore. And so it's really hard to motivate people to do that first change and to get that done. That is a real challenge we have in a limited time in the clinics to talk about what we need to.
Yeah. When you want to get somebody, I used to be a health coach, and you're trying to talk to people about their life and their habits and what they do. But actually the conversation always came back to like their mind and their mindset and their beliefs and their values and their habits. And it was never really about the food or the exercise or, any component, like any, what you deem as like a health factor. It was more around them as an individual. And that takes time to shift somebody's habits and beliefs and values. And I imagine when you're short with time, in a hospital setting, that must be really hard to implement to help people make those changes and actually be like, oh no, this is actually really important and I need to prioritize this in my life now.
It's really difficult as a clinician with the time we've got, and sometimes we have to rationalize the time we've got with being the one responsible for diagnosing it, getting a management and treatment plan in place, and monitoring the effects of complications. Because if I don't do that, I'm not doing my job properly. But all of this can be modified by getting things right at the front door. And for that, we have a wider MDT that can help out. So we have dietitians who can help out in terms of food diaries and seeing what people are eating and suggesting changes, small changes here and there that can make a huge difference. What we're really short of in pediatrics generally, but particularly in nephrology, we're very short of psychological support, and we're very short of key workers and youth workers. And in my experience, when I've worked in places that have got good psychological support and good youth workers, as well as the general kind of psychological health they promote in terms of socialization of children with chronic conditions, stuff like that, they can really make massive differences on the ground in terms of these values and these lifestyle changes. And I think and I wish we had more of that rather than some other resources that might be put our way for this type of thing. But again, your podcast is about prevention, and prevention is the best cure for this type of thing, and it has to happen at a population level.
Yeah, I agree. What about technology? Would that kind of bridge that gap a little bit, where we have not only for prevention but also to supporting people after they've seen you, as an example. There's a lot of, I've got my Garmin on now. There people have their Apple Watches and Whoops and all sorts of things which can help you measure the impact of how much exercise you do, how much sleep you've had, the stress levels. You can obviously input like what you've eaten, etc., etc., trying to really support people with their health. Is there anything now that where we can potentially look at managing our blood pressure, particularly for children, but obviously for adults as well, to kind of mitigate this issue?
Yeah, it depends on your personality type, I think, as well. A lot of people have, wearables and tracking devices, and I know some people really love that measured and examined life where they know how many steps they've done, they know
Yeah, a bit obsessed.
how much they moved overnight, how much REM sleep they got, and some people just aren't interested in that kind of thing. But technology can be helpful, but it's going to be, it's going to be one string to a bow, really. What we're particularly interested in is if we can get over this measurement problem and this reproducibility problem in children. And when we get over that, the best way of measuring someone's blood pressure, if you think they've got high blood pressure, is what we call a 24-hour study. So if they're not symptomatic and they're over 5 years of age, we won't jump in and do anything. I'll confirm, because a lot of children come to clinic, they're a bit anxious and their blood pressure's high. We send them home with a monitor that automatically records, like a little iPod style things, and I download that result. And by doing lots of measures whilst awake and asleep and averaging those out, we get a much more accurate picture. So we're quite excited by the advent of some of the things we're hearing about is indirect, non-invasive tracking devices that actually might be able to measure blood pressure. And these need to be properly studied and evaluated because we've not yet had a wearable wrist device that can accurately measure systolic blood pressure. But some of the new softwares out as far as I'm aware and what I've heard of them, are getting closer and closer and closer to that accuracy. So in the future, wearing just a simple band that can be tracking you through 24 hours a day will give us a better idea of what you were doing, how hypertensive you are, and what's happening after we make some interventions. So I think that level of technology is going to be good. Wearables is going to be, I think, a big thing in the future, and adding blood pressure to that array of things it can do, the Apple Watch and the Garmin's and your Samsung, whatever it is. There are lots of other good various available.
There's lots of brands.
Lots of brands available. But yeah, that's good. There are, for various chronic conditions, there are like monitoring apps and, a little bit like Duolingo, but for hypertension or for chronic kidney disease. And they can help with dietary support. They give you encouragement. They make these little comments afterwards and they're quite encouraging. I don't know about their actual efficacy in the long term in terms of being studied. I mean, they all seem like a good idea. But I think you need as many tools as possible and have to make the right kind of prescription for young people based on what you know about them, their personality types as well, because one thing will work for one and not for the other. And there may be something in coming augmented or virtual realities as well, or essentially where some wearable glasses devices or kind of augmented things actually look at the packet that you're about to eat, will tell you what's in it and will tell you about the sodium content and other things like that. But I think that also starts to veer onto some kind of quite invasive lines, and I worry about that as well.
I think there's a fine balance with this. I mean, we can go on an absolute divergent area talking about technology because there's so much to talk about. I think for me, there's a place for AI technology, advancing wearables, etc. But I also think it does need to be paired with an individual's awareness of their own health and having an understanding of, the information that we're talking about today around blood pressure, what it is, the risks of it, what's causing it. And so to your point, it kind of needs to be layered. There needs to be that interaction with a medical setting. There needs to be those tests. There needs to be an individual recognizing symptoms. And that's just, for me, the icing on the cake is those wearables to kind of keep people checking in and keeping them accountable too. I think if we rely too much on the wearables and don't have the awareness ourselves, there potentially could be problems down the line there as well. So, I think everything that we've spoken about today is so incredibly helpful to make people more aware of the importance of actually that these issues are happening at an earlier age. And actually, our society is shifting in a way that isn't healthy. And we need to be on an individual level taking more responsibility for that, because ultimately each of us is a part of the society too. So what would you recommend for any parents listening? Obviously, today we're talking about children, but to kind of leave on a note, if a parent's listening to this and they're thinking, oh gosh, I haven't even thought about that. And, my child may be carrying a bit too much weight, might not be, but I want to just check that they're okay. What would you recommend that they do?
Well, I mean, each child in the UK probably has, general practice contacts, 3-4 times a year for various illnesses. I would ask that parent or parents, make a mental note the next time you're with a healthcare professional, just to ask about blood pressure measurement and would they mind measuring it while you're there, and write that number down. And if the person who's taking the blood pressure isn't confident in interpreting that number, they can ask another healthcare professional. We as paediatric nephrologists take loads of phone calls, emails from general practitioners, community nurses who are out there doing things, and they say, well, I've measured this blood pressure, I've got this, I'm not quite sure, what does it mean? We're more than happy to give the answer or the advice that somebody would need. But I think it's, like you said, awareness and opportunism if they're worried about that. And if they are specifically worried that their child might have a problem or symptoms that we've discussed today, alongside carrying extra weight, then I would make a GP appointment and ask specifically for the blood pressure to be measured.
Yeah, amazing. Great advice. Thank you very much. And we'll link some of the websites that you mentioned earlier as well in the show notes. So, Dean, thank you very much.
Thank you.
Great. Wow. Well, we covered an awful lot of ground today, and I truly hope that you're walking away with a fresh perspective on just how important blood pressure is for all of us, including children. I know it isn't a topic that most of us think about day to day, but as we've heard, it is such an important part of protecting our long-term health. What I love about this conversation, and in all the conversations we have about blood pressure, is it's not about scaring you. It's not about fear. It's about awareness of the simple, everyday steps we can all take to protect ourselves and the next generation. I want to say a huge thank you to our brilliant guest, Dean, for sharing his knowledge and helping us better understand the growing issue of high blood pressure in children. As with all our episodes in this series, we've recorded an exclusive follow-up question with our guests that you won't want to miss. This time we asked Dean, if someone wanted to make just one change this year to reduce their risk of high blood pressure, what would you recommend? To hear his answer, head over to our Instagram page and join our Change Collective broadcast channel. And as we start this new year, I'd encourage you to make checking your blood pressure part of your health routine. And don't forget, you can sign up to our free reminder service to ensure you don't forget to do so. It takes just a few minutes, but it could make a world of difference to your health. Thank you so much for listening today, for being part of the Nathy Kate Moss Trust community, and for helping us raise awareness of this vital issue. Until next time, take care of yourself and those around you. And here's to a healthy and hopeful 2026.